My name is Dr. Marwan Bahu, and I'm a cardiac electrophysiologist. So what that means, I'm a heart doctor who specializes in the electricity of the heart. I deal with people typically who are born with electrical issues, so I can deal with kind of young people in their teenage years, or oftentimes I deal with people who had a heart attack later in their life, and the heart attack disturbs the electricity of the heart and create an unstable situation that can lead to death. And my job is to figure out, what are the serious problems and how to treat them and prevent people from, dying suddenly or at least suffering from electrical disturbances.
Okay. So what led you to specialize in cardiology and then specifically electrophysiology?
Yeah. So when I went to medical school, I didn't really have a clear idea what I wanted to do. If someone asked me, I would kind of romanticize about doing something that has to do with emergency room medicine because you watch that on TV, that looks kind of cool. You tend to save people who are in trouble, who come in bleeding or having a car accident. But when I, went to medical school, I did my emergency room rotations. I realized that's the last thing I want to do. So, but when I did my cardiology rotation, that clicked for me. I think I'm kind of have an engineering inclination, and the heart made sense to me. It pumps, it moves blood, it has an electrical system. So it had more of an engineering component, and it was more to my liking. So that's why I went down the road of cardiology. But as far as electrophysiology, it was just because I was at the right place at the right time. Electrophysiology, the study of the electricity of the heart, was kind of a new field back in the late 80s when I started medical school. It
Mhm.
took off in the early 90s. So as I started my internship and residency, it was just kind of starting off. And it just happened that at the University of Michigan, where I went to medical school, it was one of the leading centers in electrophysiology. So by chance, I got to see a lot of patients with electrical issues. People would come from all over the Midwest and the surrounding areas to the university. So we had a very busy service, got a lot of exposure, and decided, oh, I think I like this. So just fortuitous.
Okay, so now let's talk about, the cardiac screening, which is the topic of this interview. So first, like, what are some common symptoms in patients that you see that could indicate, an underlying heart condition? And then if they're asymptomatic, what like precautions can they take?
Yeah, so the typical patient's symptoms that clue you into something going on with the heart could be obvious or it could be subtle. The obvious things would be palpitation. Somebody comes in there, says my heart doesn't beat regularly, it skips, it races. They can come in and say I passed out. So that's a clear symptom that indicates something is wrong. So these are clear symptoms. They come to you and say, every time I exercise or I run on the basketball court, I get chest pain, I get very short of breath, I have to back off. I don't keep up with people my age, my friends who seems to have more stamina than I do. So these are all clues that something is going on. The subtle ones would be someone who feels a little tired, but not sure why they're tired. Is it because they're out of shape, they're not exercising, frequent enough? So that could be a subtle symptom. Sometimes people just, um, uh, don't really have a clear-cut, symptom, but general fatigue, so that really could be subtle, but that requires more investigation. Family history. So people come to you often saying, listen, I have a very strong family history. I know young people in my family, died suddenly. So that's very alarming. That kind of points you toward a genetic predisposition that you need to investigate.
Okay. And then my next question is, can you share a story or experience, if you have one, of a young patient whose life was saved due to screening or other medical intervention you that you did?
Yeah. So, I was reflecting on that, and I just realized I don't really have a whole lot of people that I screen. So, screening in my specialty is not done commonly. I think it should be done more. We tend in medical, in American medicine, we tend to react to events as opposed to kind of be proactive. So that's a fair criticism of our profession.
Mhm.
But when I think back to maybe someone that I made an impact on their lives, I have to think back to my internship. I was just starting my internship, and I saw someone in the clinic who was a 14-year-old, and I can't remember exactly why his mom brought him in, but maybe it was palpitations. And I listened to his heart, and I said, "Wow, there's something there that's not wrong." I heard a murmur. And then when I tried to feel his pulses, they definitely felt irregular. And when we investigated it further, we realized that he had a hole in his heart. In the upper chamber of the heart, he had a big hole. Had we missed that, and then fast forward 10 years, and he showed up again, by then that hole would have resulted in weakening of the heart muscle and development what's called a cardiomyopathy and congestive heart failure. So that he would have gone into a very serious path toward the compromise of his health. And I was proud of myself because the murmur was kind of subtle. The pulse that I felt in his neck, I had to really feel it for a long time to make sure that it didn't feel right. And I just kind of, set the alarms to get further evaluation. He had to have open heart surgery in order to fix that hole. Back then, we couldn't fix that hole, just going through the groin or the shoulder. It had to be open heart. And I saw him after the surgery, and he'd gone on to do very well after that. The most common patients I see right now are not, patients who've been screened who otherwise don't have any symptoms or have minimal symptoms. The typical young patient I see in their teenage years are people who have already had some kind of event. So I've seen a lot of people who they're playing sports and they pass out, or they play sports and they go into a very rapid heartbeat. So there are a lot of conditions that I deal with, like long QT syndrome, hypertrophic cardiomyopathy, other rhythms called WPW that could cause some serious injury, but the first presentation is passing out. So I tend to kind of jump in there, do something about it, diagnose it, and lucky that the first presentation was passing out and not dying. So I make sure that it's treated, taken care of, so they won't die from it.
Wow. So my next question is, can a single EKG test detect an underlying heart condition that may lead to a sudden cardiac death, or do you think additional tests must be conducted to have a conclusive diagnosis?
Right. Yeah, a single EKG may give you a clue, or sometimes can give you a clear-cut, diagnosis, like in long QT syndrome. But you can have some serious heart conditions and have a completely normal EKG.
Mhm.
So an EKG at rest may not tell you the whole story. So to really increase the chance of you finding something, you should get an EKG during exercise test. So that's the first thing you do is put somebody on a treadmill because you can uncover some abnormality of rhythms with exertion, you know, and symptoms with exertion are always a lot more serious than at rest, So that's one way to really increase the yield of an EKG. But yeah, a EKG at rest may not tell you the whole story.
So this brings us to the final question. So personally, do you think screening should be mandatory for all student athletes? And if so, how often and what type of screening?
Yeah, it's a very controversial area, as you probably already know. And the reason it's controversial is really a serious event in athletes is really rare, even though it's really tragic. So it gets a lot of the headlines, but it really not a common event. The problem with screening, though, the reason why people hesitate about screening everybody is you can get into the situation what we call false positives. So you get an EKG or you do an echocardiogram, it's not an always black and white diagnosis. Oftentimes, some serious diagnoses require multiple tests. And even with multiple tests, you kind of say, okay, the probability is you probably have this. And there's not 100% certainty whether you have it or not. So you may end up diagnosing people with things that they don't have and cause a lot of anxiety and kind of limit, modification of lifestyle for nothing. So, do I believe in screening? Yes, I think I believe in some screening. I definitely think young people, even non-athletes and non-athletes, should be evaluated by their pediatrician on a yearly basis and be asked a set of questions, about their personal history. Things like palpitations. Do you have chest pain? Have you ever passed out? Ask about their family history. Also get an exam. So I believe in personal history, family history, and an exam to start out with. And if you hear anything on exam or you hear anything in their history that is concerning, then you take the next step, which really includes an EKG, echocardiogram, a stress test, prolonged monitoring. But if you start out with everything for everybody, I think
Mhm.
that leads to a lot of cost and leads to a lot of false positive, i.e., misdiagnoses that really, cause more harm than good.
Okay, those are all my questions. Thank you so much for your time.
My pleasure. Thanks for having me. I appreciate what you're doing.
Thank you. Thank you.
All right. You take care. Bye bye.